Yeah, just welcome to WeTalk again. So this is the third one we've done now, and today Kelly's going to talk about our 8Care service, which within wellness is the smallest service we've got within wellness, but the impact it has, and you'll see that as Kelly goes through the presentation, the actual impact and the amount of people it reaches out to is just absolutely staggering for such a small service. So there we go. Without further ado, let me introduce to Kelly Sewell, who's our project manager for the 8Care service. So over to you, Kelly.
Thanks, Simon. So just to introduce myself, as Simon said, I'm Kelly Sewell. I'm the project manager and service lead for the Diabetes 8Care and early onset type 2 services. First of all, I just wanted to give you some concept as to how diabetes is affecting the NHS. So 1 in 10 people over the age of 40 are now diagnosed with diabetes, which equates to 4.7 million people in the UK, and this is expected to rise to 5.5 million by 2030. Treating diabetes and the various complications it causes is costing the NHS £14 billion per year, which is 10% of their overall budget. And it's thought that social deprivation and health inequalities are a major concern, as well as income, education and healthy food, which is increasing obesity levels and patient diagnosis. So to give you some background to the implementation and delivery of this integrated clinical model to support diabetes, in May 21, the NHS Diabetes Programme held a deep dive within the regional teams, including the Diabetes Clinical Networks, Public Health and Diabetes UK. The purpose of the deep dive was to understand the impact of COVID-19 on the population within diabetes. It was recognised that the decrease in care process delivery and reduction in treatment target attainment was a direct impact of COVID-19. Identified as part of the deep dive, the Staffordshire Stoke-on-Trent system had seen a significant percentage reduction in the proportion of people who received all 8 care processes for both type 1 and type 2. In July 22, Diabetes 8Care was introduced as a community-based model where GPs could refer patients who were housebound, so their 8Care annual review could be performed. During the first few months, it became apparent that the KPIs could not be met as clinicians were travelling across Staffordshire more than seeing patients, so the service moved to a clinic-based model in January 2023. They positioned the clinic within Bentley Neighbourhood Centre, and it was next to diabetic eye screening, an area known for its deprivation and need for more support for diabetes patients. The aim was to create an intervention service focusing on patient care, which could integrate with other diabetes services and make appointments more accessible by improving the patient journey of one appointment, which could complete their 9 care processes in one go. This would make diabetes services more efficient and sustainable, whilst also addressing health inequalities. So just to, for people that don't sort of know what the 8 care processes are, so the 8 care checks that we perform within our service are the HbA1c, which is done via blood test, their blood pressure, the cholesterol level, which is done by blood test, their kidney function, also by blood test, their urine sample, the foot surveillance, their BMI and their smoking cessation. Rio, we basically fill out an assessment completed form, which gets sent to the GPs via Rio, via Docman, and then they add that to EMIS for them to meet their targets. You will sometimes hear that there are 9 care process checks, but the 9th one is actually eye screening, which sits under a separate target for primary care. So the Diabetes 8Care service forms part of the overarching Staffordshire and Stoke-on-Trent diabetes strategy, which encourages diabetes intervention and prevention and also aligns with deliverables of the long-term condition strategy. The 8Care model allows patients to have all 8 care process checks completed in one appointment, whereby the GP can follow up their annual review on the phone, which releases much needed appointment time within primary care for other patients in need. The service provides additional capacity and support to primary care, targeting patients not engaging with primary care and considering ways to reach core health equity patients living in the most deprived areas and also ethnic minority groups. The service has the infrastructure to target these patients more effectively using non-clinical venues such as mosques and football clubs, and offers out-of-hours clinics to those in need. The service model responds to the NHS strategy of social engineering, so it's engaging the diabetes population in their annual checks, but also highlights the importance of education around long-term illness and the importance of the patient's role in prevention, remission, and their own role in improving their health and well-being. It also responds to social value by offering appointments during out-of-hours clinics and within local community assets such as village halls, community venues and health centres. As more people engage with their 8Care checks, this preventative concept provides a return on investment by educating diabetic patients more effectively. This preventative aspect is a core part of the Staffordshire Diabetic Strategy and can lead to instances of diabetes patients controlling and sometimes even reversing the effects of their diabetes, ultimately reducing hospital admission, obesity, and limb amputations. 8Care have targeted clinical settings in health centres, primary care centres and GP practices, where health inequalities are at their highest across Staffordshire and Stoke. GP support in working across PCNs has been fantastic, with each clinic servicing up to 5 practices at any one time. The 8Care admin team contact with patients using a really targeted approach, where once referrals have been made, the GP texts those patients to advise them that they've been referred to our service. And then we follow this up with phone calls, texts and letters to gain a positive response. This has managed to engage those hard to reach patients currently unengaged completely with their care. In addition, we use accessible clinics in non-clinical settings such as local football clubs, health events, pop-up events, where we can capture patients most in need. Our reporting framework has helped us identify many patients with medium to high foot risk and hypertension. We found that many patients in this case have not had a foot check carried out for years, and blood pressure has only ever been requested by GPs from patients' own devices, such as watches or individual machines, which is not always accurate. HbA1c tests seem to feature as the more predominant check, but once bloods are taken, the patients do not tend to go back to their GP to complete the remaining checks, so the review is always incomplete. 8Care's aim is to predominantly target those patients disengaged with primary care and not patients who regularly attend appointments and take care of their health. We want to increase the number of patients accessing their routine appointments and drive the importance of having their checks completed every single year. We believe that an holistic approach will help to support the NHS strategy and in the long term provide prevention for patients in the future. Just to update you a little bit about who we are and what the team is made up of. So the team is currently made up of myself as the project lead, a senior healthcare assistant and 3 additional healthcare assistants who all work part-time hours in the main. In addition, we also have 2 administrators, 1 full-time, 1 part-time, doing all of the targeted approach to engaging patients. We currently have no lead nurse, so rely on clinical support from forensics who have kindly offered to support us in this area. Hopefully the long-term plan that we would have a lead nurse in the future. We'll soon be operating 14 clinics per week across Staffordshire and Stoke, and as you can see from the map, cover a vast part of the area with a relatively small team. Primary care have now become a huge support for us and a huge part of the service in supplying clinic space for us to deliver our service effectively across many practices. So just to give you some of our positive outcomes really and some of the things that we've achieved since we launched. So whilst our team is now more established, these figures are literally only based on 2 clinicians out there on the floor. And that's been since January 2023 to December 2024. The slide outlines the positive outcomes we've created within the service. So to the end of February, we had engaged over 2,500 patients. In Stoke, where we've developed the service alongside diabetic retinopathy, 77% should I say, of those patients have benefited from an integrated appointment, which has had a positive impact on the patient journey. 58% of the patients seen to date are known to be living in an area of deprivation or sit within our health equity groups, including ethnic minority, BAME communities or patients who are known for disengagement, including male patients aged 40 to 60 and patients under the age of 50. Diabetes 8Care have managed to save an astonishing 46,300 minutes of appointment time within GP surgeries through offering all 8Care checks within one appointment and integrated appointment times with other services. This has enabled GP practices to offer other patients much needed appointments for other long-term conditions. The service has also captured a staggering 72% of patients who had not attended 8Care for 18 months or more. 30% of that hadn't attended for 3 years or more. The service has now managed to engage 49% of all GP practices across our geographical area, meaning more patients are benefiting from our service. The service has also engaged an even split of male to female patients, but this is also impressive considering the national data suggests females are far more likely to attend than males. 41% of our patients have been diagnosed with moderate to high foot risk, which, considering foot amputations are on the increase, is no surprise. 36% of those patients had previously never engaged with a foot check since diagnosis. This again supports our service model to deliver all 8Care checks whilst we have the patient at one appointment, increasing patient care and safety, and will further decrease the risk of amputation in the future, 85% of which can be avoided. There appears to be a clear need to ensure that diabetic foot care is delivered in an holistic, integrated and urgent manner, and GPs are now looking at adopting our approach. Finally, the integrated care model has contributed towards an average saving of 18,600 miles of travel, minimising carbon footprint overall. The team have faced many challenges over the last 2.5 years, and this slide identifies the key areas affecting us both previously and currently. Recruitment has been difficult due to offering fixed-term contracts only, and this creates a problematic area if people look for other alternative jobs because we then can't replace them. Once the service moved to a clinic-based model, GPs completely stopped referring as they were carrying out these checks with GP practices and didn't see the need for the service to continue. GPs were really negative about the service and what we could offer. Engaging high-risk patients living in areas of deprivation is both difficult and extremely time-consuming, but we've persisted and persisted, and now the hard work is paying off. Awareness of the service was minimal when I joined the team and has taken time to establish across a really large geographical area. Recurrent funding has still not been established, even after the service has been operating for 2.5 years. And obviously, with the current challenges with the NHS, nothing is guaranteed. Finding clinic rooms available in the right locations at the right times has proven challenging and has at times held growth of the service back. Many GPs now fully support our service and have become reliant on us to support their plans to increase engagement with patients. If recurrent funding cannot be sought, this will have a significant impact on certain areas and PCNs overall. The team are passionate and believe the service is essential to some diabetes patients, but growth is limited with a small team. Staff are likely to seek new employment should funding not be available, which at this stage could damage the output we are planning for the next 12 months. However, taking all the challenges on board, we have overcome many, and this slide demonstrates the success the team have created. So part of the engagement was that I attended the regional engagement forums where all GPs attend for 3 different areas. We use this to engage practices and increase patient referrals. We now run on a patient referral solely. We don't have to find our own patients anymore. In fact, we're currently turning GPs away because we don't have the staff to facilitate the referrals that are actually coming into us. We've attended PCN meetings, localised networks to engage practices most in need, and this has had a huge impact on being able to service the PCN as a whole. So rather than just working with direct GP practices, we now work within one practice to service the whole PCN. We were shortlisted last year for HSJ Award for Community Care Initiative of the Year, and we were also shortlisted for Smarter Working Awards for Innovation as a Service. The Midlands Diabetes Advisory Meetings have now asked us to be a regular guest speaker to share best practice and delivery model, and this has created a lot of inquiries about the service nationwide. Diabetes UK have also asked us to be a guest speaker last year at their October Leadership and Learning event, where I shared examples of the innovation that we're creating. And they've also asked us for an extract so they can spotlight our service at their annual conference in June. Following all the engagement, ICBs are requesting meetings to understand our service model now for implementation in other areas of the country. The map shows the many ICBs who have reached out to us following the engagement work we have undertaken. So in addition to Diabetes 8Care, we also deliver the early onset type 2 service. Type 2 diabetes in the young is a nationally funded initiative to improve care and outcomes for people aged 18 to 39 years with type 2 diabetes, and MPFT has been commissioned to deliver this alongside 8Care. When the ICBs made this decision, most of them, in fact, I think most in the country, gave the funding to primary care, but Staffordshire and Stoke chose to put it with us. Early onset type 2 has been associated with being the most rapidly progressing and aggressive onset of type 2 diabetes. So by working with us, people living with early onset type 2 can identify any health issues promptly and avoid diabetes-related complications. This in turn aims to improve outcomes for people with diabetes and reduce health inequalities and healthcare costs in the long term. Our team offer 2 appointments for this service, and in addition to their 8Care review, offer patient support with reducing their HbA1c, weight loss, mental health and wellbeing, smoking cessation, pre-pregnancy advice, and any other unmet social need which could be affecting their ability to look after their own health and wellbeing. In turn, the service aims to offer a journey toward remission, reducing medication, maintaining an active lifestyle, and guide friendships and support where necessary. By supporting patients using an holistic approach, this has allowed the team to work in an integrated way with many services across both MPFT and the voluntary sector, and the list of stakeholders wanting to get involved in our service continues to grow. Everyone Health has supported us with weight management and smoking cessation across Staffordshire, and this works for both services, D8 Care and early onset type 2. We are now regularly invited to all health events, including Support Staffordshire, which has helped us to develop the service within primary care and build awareness for patients. We regularly promote Diabetes UK, diabetic retinopathy, Desmond and pathway to remission to our patients, and literature is given to patients at every appointment. Patient feedback is often that they've never been given any educational leaflets before, and this helps to control their health. The early onset type 2 service has also developed relationships with Silver Cloud website, where we offer supported and unsupported opportunities to help with patients' mental health. Talking Therapies is also a service we are discussing with patients, especially those within the early onset category. In addition, we've created a referral manual which allows our clinicians to signpost patients to local groups and amenities that could help them in the future. One of the main things I am passionate about when trying to reach patients of health inequality is enabling patients to access services in settings which are comfortable and accessible. Therefore, we set out to organise a number of health events which could help in achieving this. We chose bespoke venues which target patients who may suffer from white coat syndrome. We've used mosques which target the BAME communities, and local community venues during out-of-hours clinics which reach those health equity patients who have become ghost patients due to the lack of accessibility. So far, during our events, we have managed to engage 133 patients across 5 events with a low DNA rate of 6%. 46% of those patients seen had not engaged with their annual review for more than 3 years. 84% of those patients were male aged 40 to 65, which has captured a health equity group hardest to reach, according to primary care. The feedback from patients attending these events has been exceptional. And in addition to our service, we have invited Diabetic Retinopathy, Everyone Health, Pathway to Remission, the Diabetes Specialist Teams and Diabetes UK, creating a one-stop shop for diabetes patients to really understand their illness and consider ways to improve their own health. You can see from the graph here that the results speak for themselves, and we have many more planned for 25-26. Just recently, Diabetes UK shared some data with my team, which I'm really pleased to be sharing with you all. Recent figures released suggest that with the help of Diabetes 8Care, Staffordshire and Stoke-on-Trent have seen the biggest increase in uptake of 8Care checks in 23-24. And together with primary care, we have managed to increase uptake from an average of 21.5% to 55.1% since 21 to 24 across both type 1 and type 2 patients. Diabetes UK were happy to share we had contributed to seeing the biggest increase in the region, so we're really excited to see what the 24-25 figures will show. Final few slides, I just wanted to share some of the patient feedback we've received, which suggests that our service is really, really positive for the community. Patients say it's a great opportunity to have access to the right people all in one place. Nurses, eye screening, Diabetes UK, local support groups and practice staff give them a really, really good objective to look at for their diabetes care. That the advice they've received helps provide confidence and belief that they can manage their own diabetes and they can improve their health and well-being. The one-stop shop saves attending multiple appointments, which has saved time, travel and helped reduce carbon footprint. It also results in many elderly people not having to rely on more than one lift to attend their appointments because they can do it all in one go. It offers greater patient choice by offering weekends, saving the need to take time off and engage with their care more effectively. A variety of venues allows that partnership with our colleagues in the community, and the services have been found to be very efficiently run and very knowledgeable. In addition, we've also received some fantastic feedback from professional colleagues, including primary care, PCNs and commissioners. They say every patient is entitled to great care, but the partnership working has helped strengthen this service provision, and they are extremely privileged to be helping us to bring this into the community. The data that we create is processed in real time, thus reducing pressure on all of primary care, which is already overstretched, and it enables clinicians to see the full picture as lab results come through via their systems also. We often talk about integrated care, but in reality, it rarely happens. Our ICB have recognised we are a great example of integrated care in action, involving practices, PCNs, trusts, and the voluntary sector. Pooling of resources helps to strengthen relationships and increase capacity in relation to additional sessions we've been able to provide. The data captured, we're seeing that historically that hard to reach patient is now coming through the door. And NHS England hailed us as trailblazing because we collaborate effectively with other services. Burton PCN, who we've worked with really closely, suggest that we delivered our model to them, we started a conversation, we worked together and we made it happen. So just to end and just to close really, we believe we've created an integrated care model which has already improved accessibility within communities and provides an end-to-end holistic pathway, especially for those living in areas of deprivation. Diabetes 8Care have used an innovative approach to increasing patient engagement and believe this model is not only effective locally, but it can be scalable and replicable across the nation. We think we've demonstrated that through partnership working with the ICS, primary care and continuing outreach, we have significantly made a positive impact on patient care, safety and outcomes for those living with diabetes, and this can be shared as best practice across all regions. And finally, as we come to the end of my presentation, I just wanted to leave you with a testimonial which we only received in about 2 weeks ago, which supports the huge impact we believe we're having on the diabetes community in Staffordshire and Stoke-on-Trent, and it's a testament to the outstanding work of the team and their passion for our service. Our commitment to patient care and health equity is evident and is making a huge difference to both patients and primary care. Is having a real impact on patient health and accessibility to the care. And I've just pulled some data from our RIO, which suggests that 86% of our patients have reported an excellent patient experience when visiting our clinics. So thank you for your time today. If anybody's got any questions, please feel free to ask.
Thanks, Kelly. Fantastic tour of the 8Care service. So, and I think the things that have been achieved, the amount of people you've seen, but also about 86% of people who've responded saying you're delivering an excellent service. I think that's quite enviable. So within a lot of our services. So I suppose questions, have we got any questions? Bit of activity on the chat. People saying, well done, fantastic presentation, but no direct questions. So I'll open it up to the floor then. Are there any questions? Fiona?
Yeah, I've got a question. We were asked if there was any way we could get more people into our service for sexual health screening, and the age group they were looking at would be sort of the age group where people were getting late onset diabetes. And I was wondering whether you said you signpost to sexual health.
Yeah.
What do you do when does
We
everybody
don't
get?
No, we don't currently signpost to sexual health, but because of the with the early onset service, we have to give pre-pregnancy advice, because a lot of young people with diabetes don't realise the complication of diabetes, but also that the steps that they need to put in place before they think about pregnancy. So we linked with sexual health around being able to offer contraception and that kind of thing. But if you wanted us to start working with you guys around promoting your service, then I'd be more than happy to have a conversation around that if you're looking at ways to get referrals in.
I think that would be a great idea, because obviously our hardest to reach sort of people are in their sort of 40s, 50s and 60s. And that's where we've seen the most increase in STIs actually. So
Okay.
there is free online screening available through the council via SH24. And even if we could just give you like leaflets just to pass on to people to say, you don't have to go to the GUM clinic, you can screen at home in the privacy of your own home.
When we offer a 30-minute appointment, and part of that 30 minutes is around education. So we always make time to make sure that patients have got the leaflets that they need to help them, and we could include that. And there's also the option that when we do our events, you'd be more than welcome to come and have a stand. The events have been so successful, and we get a lot of that age category coming to our events because they're out of hours, and it's a lot of patients that work. So we don't tend to have the really elderly on those. We tend to have that sort of 40 to 60 category. So that might be a good opportunity for you as well, if that was something you were interested in. But happy to link with you, Fiona, after this and get a meeting in place, and we can have some discussions. We can definitely carry your leaflets. That's not a problem at all.
That would be fantastic. Thank you.
No problem.
That's a bit of a positive outcome. Fantastic.
That was easy.
Yeah. Do we have any other questions? There's a lot of people saying fantastic presentation and everything and great service. But I suppose, do we have any other questions or any other bits of information required? There are no hands showing. So if that's the case, then shall we just call it a day? Folks, the chat's going to be there. So if you walk away from this and think, oh, I did have a question, Lou?
Just a quick one, Cal. Do you keep a record at all of those that you have screened from our service that have come direct from Diabetic Eye Screening? Do you have numbers that you could feed back to us of those that have had their 8Care check following the eye screening?
Yeah, so from the early days, they weren't sort of reporting on that, but we have now got that as part of our sort of assessment form. And to be honest, we know from when we swapped over, because we used to do all of your patients, didn't we? And then it moved forward. So I could probably work that out quite easily, to be honest.
Lovely. Yeah.
And then from the new form that we've got, we actually record if it's a GP referral, whether it's a diabetic retinopathy patient. So I could work that out for you. That's not a problem at all.
That would be absolutely fantastic. Thanks, Cal.
No problem.
Thanks, Lou. Okay. Any other questions, queries? No. Kate Matthews? What are you doing about survey? Anything about survey?
So yes, I am going to drop a link to a quick survey in the chat, just asking for feedback on the session and the sessions that we've held. Well, the last session as well. So feel free to fill it out whenever you have the time. It will be in the chat for the remainder of the week. Yeah.
How do we view old sessions? Because I got the forensics one sent to me, but then Simon mentioned this is the third one. I don't know what the first one was because I wasn't included because I think there was some issues, wasn't there?
So the first session wasn't actually a WeTalk session, was it, Simon?
Oh,
It was
okay.
more of a
It was part of a
talk
wellness week. Yeah.
Yeah.
Okay.
Yeah.
Oh, that's fine then.
I think I do have a link to that. If anyone wants it, feel free to give me a shout and I will send you the link to it. I think it was Dr. Adrian Coxall. It was on trauma-informed care.
Yeah.
Okay, fab. So this will just be shared to everybody and then you can share it on, because I know my team want me to share it on to them as well. So
yeah, so we've recorded it. We'll create a link, drop it in newsletters, and we'll share it with everyone so it's available after.
Okay, lovely.
Okay, thanks,
Kate. Thank you very much.
And I suppose there is that question of if there's anything which anybody has an interest in or would like to have a session on, again, please let us know and we'll get presenters we'll arrange for presenters to come and talk about the different services, the different options, the different types of training which are being rolled out. So we've got some ideas for future sessions, but if anybody does have a burning desire for a particular thing, then let us know and we'll see what we can do. And with that, we'll call it a day. Have a good weekend, everybody. Thank you very much for coming along, and thank you, Kelly, for presenting.
Thank you.
Thank you.
Thank you.
Take care.
Bye.
Bye.
Bye.